Can't get enough, you know you're gonna have to face it. You're addicted to love. Dick, 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 dick. Hello friends, I'm Kim Passable, and today we are not here to talk about dick or love. We're here to talk about these nuts. These are not the nuts. They're just symbolic of the nuts. And we have questions. It has been just over 3 months since my bilateral orchiectomy, and I'm feeling good. So we're gonna start with some questions. The first one was, did it hurt? Well, yeah, they cut me open and they removed my nuts. Yeah. I mean, yeah, you would think that would hurt a little bit. I really was dysphoric about having nuts. Like, they're gross. Even long before I thought about being transgender or transitioning, I've always despised them. They hurt, they get in the way, they get smashed when you're trying to move around. They're very uncomfortable, yuck. You know, and then when I found out that that was what was creating this testosterone that made me into a guy, and I see all the things that were happening to my body because of testosterone, I hated them. Hated them. Despised. They are my arch enemy. When they said, we can chop them off, but it'll hurt, I was like, so go do it. Do it. I was going to do it myself. I really wanted to do it myself. Not wanted to, but I really thought about it. I looked up the anatomy, how to do it, specifically how everything was connected, and I was full on prepared. Okay, if I can just get them out and get rid of them and then call an ambulance, I won't bleed out before they sew me up. And let me tell you, that is not a good idea. Bad, bad, bad. Don't do that. We didn't do that. I went and I talked to a doctor at the women's hospital, and she deals with actually men's reproductive health, and I was like, well, they're nuts, you know, I guess that is a doctor. But she was super nice, and she has patients who are trans, and she has done orchiectomy before for transgender patients, so she knows how it works. And she did a single center cut, bilateral orchiectomy, both nuts, yeet, gone. So that was the process. Did it hurt? Yeah, it felt like a punch in the nuts. You know, when I woke up, it didn't hurt because they put me to sleep. I didn't feel a damn thing for the surgery. And when I woke up, I was like, oh, cool. So I got up. Once the dizziness from the anesthesia passes, you get up, you walk out to the car, you ride home, you sleep the rest of the day. When you wake up in the morning, it feels like someone cut your ball sack open and punched you in the nuts as hard as they fucking can. As hard as they fucking can. And then that feeling lasts throughout the day, you know? And they didn't give me any special medication, because come on. Everyone's been hit in the nuts before. It hurts, but you don't die, you know? And I was glad. I'm like, thank God, once this is over, they're gone forever. So fucking worth it. Would do it again. Would recommend. If you are dysphoric about your testicles, go and get an orchiectomy. How long did it take to heal? About 2 weeks. And when I say about 2 weeks, I mean at the end of 2 weeks, the stitches were ready to come out. And the scar, didn't even have a scab on it anymore. The skin of your scrotum is incredibly good at healing. So in 2 weeks, boom, healed. The nerves, you could still feel so they cut the nerves and tie it off because there's a lot of blood flow. And so you could feel it's kind of pulling up into your abdomen, and it's tight, you know, there's a crampy kind of feeling. But come on, don't be a baby. It's not as bad as a woman's period, and they do that every month. So, worth it. Totally worth it. Couple weeks. By the end of 3 weeks, sex. Having sex. Getting laid. Yes. No, not a problem. They didn't even know. No one would know except that I told them, hey, my nuts are gone. And they're like, oh, that's good. Do you want to fuck? Yeah, let's do this. So, I mean, pretty quick healing. And I had no issues, nothing. I didn't have to take any antibiotics, any special pain stuff like Tylenol, you know. What do they leave was a question. Do they just cut it all off? Do they No, they just cut it open, take the innards out, you know, just those, and then they sew it back shut. And so you still have a scrotum. Now, they don't have to leave it. They could take that all, but I want vaginoplasty. Like, I want a vagina eventually. I can't do it right now because it's a lot of maintenance and it's very expensive and there's a waiting list and yada, yada, yada. There's reasons, but I definitely want to have that option in the future, and they need that, like, they need that. They're going to use that. So I don't mind it being there because they're going to use it. And like, it sort of like shrinks down into like a big pad, and like, it's not sensitive in like the way it used to be, like where like you were like, oh, ow, 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 ow. It's like, ooh, you know, like, okay, like I'll play with it because it's kind of does it. I don't know. There's like, it feels kind of good. It kind of feels like there's a pussy there now, or at least it's very different. And I talked to another trans woman. Like, I don't usually discuss things this intimate with anyone, but I was talking to another trans woman who had an orchiectomy a while back, and when I said that, like, you know, like, it's kind of hot, you know, you kind of smack it, and she was like, yes, oh my God, no one's ever said that before. Like, absolutely. Does your penis still get erect? It's a very direct question. No one would ask it that way. Everyone beats around. That's the question. Like, can you still? Yes. Yes. I am still able to function. I no longer take spironolactone, which is the testosterone blocker. And honestly, it's actually easier now for me to enjoy some of that type of play. Without getting too graphic, that it can work, but I don't have the drive to use it. Like, I'm just not that interested in like penetrating somebody with it. Like, I could, like, if I've met some really attractive women and they were kind of interested, and so I'm like kind of into it, and that's cool. But I'm not like chasing after like that, because I just want cuddles and love and attention and that kind of stuff, which is, you know, like woman stuff. I want to be treated like a woman. So I don't want to be put on top for my penis, even though it can. And I would with a partner that I really cared about, but like, I don't want to be objectified into like a penis attached to a woman, you know, like, yes, I'm a woman and I have a penis, and yes, I could use it, but I probably, like, you would have to be really nice to me, like a lot of lead-in play, and really like play to my, like, you'd have to really get me into it before I would even really go there, you know. So that's like intimate play that, like, with like a dedicated partner, I think that yes, things down there could still work. Oh, so like now it's like a superpower. I am completely resistant to like groin kicks. Like, fire away. Like, it's not really, it's like
that's honestly the best superpower.
Is that a superpower or what? Like,
yeah, that's an amazing superpower.
I can block gunshots and stuff, you know. There's just a mound of flesh to stop anything, you know.
Like, someone just goes for a cheap shot and it's just like, nope.
Nope. Nice try. So there's like a pillow in my pants. You can lay your head on it, you know. You can smack your dick off of it. Oh, that would be sexy. If a guy come at me and was like smacking it with his dick, that would blow my fucking mind. I don't know why, but that's just like, just thinking about it gets me a little bit, ooh. You know, different things feel different. The sensations that we recognize will be good. That's just where they are, you know? Okay, so that was my superpower. Do I still want vaginoplasty? Yes. Yes. I don't really feel like I'm a complete person. You know, like, I'm a woman, and the penis is like very novel. Like, ooh, look at that. You're a girl with a penis. But trans women are, it's really hard to find a serious relationship, you know? So it's fun to play, but like the thought of being just like alone, except on play nights, kind of sucks. Like I'd like a nice partner, someone who treats me like a person and wants to like explore and experience life outside of playtime. And it seems like, I don't know if vaginoplasty is going to make me more desirable to a partner. It definitely feels like there's something missing. Dysphoria was another question. And so I think my dysphoria has just shifted, right? So before, that was something that was like this awful glaring thing that I really didn't like. And now it's not there. And now I'm like looking at my chin. Like my next dysphoria is my freaking chin. My penis, like, I don't care. People don't see that, but my face, right? So dysphoria is rough. It's like, I don't know. It's like herding cats or something like that. There's a lot of things that I would like to, but that doesn't mean I don't like myself. Like so I have like a sense of like relief and joy and like euphoria and inner peace about this change to me. It really feels right. Before, I felt like there were days where I would like lean very masculine and other days where I would lean very femme, or I'd kind of be switchy, or I would feel awkwardly not congruent. And I don't feel that way anymore. I really feel like me, like whole and me most of the time. Like it doesn't feel like there's so much separation. I feel a lot more congruent. And I don't know if it will, maybe a lot of it is because it's so new. It's just such a nice thing that I recognize it, and it's very joyful and fulfilling. And maybe with time, other things will start to appear that I feel like I need to address as well. But right now, I'm really living in like a euphoria of this is such a great change that feels good. There have been some other body changes. I was really hoping that with the lower levels of testosterone that I would get some increased breast growth. And I even added progesterone supplement my doctor added to my HRT, and I've been taking that every day, and I don't have any tenderness, and I haven't noticed any increase in breast development. So I think that's just at an end. We're coming up on 3 years of HRT, and some girls don't have nearly what I've developed, and some girls just stop. So I'm still holding out that there could be like a resurgence, but not so far, not related to bottom surgery. I have noticed that the hair on my arms and like I have a little bit of hair on my belly and the hair on my legs, it's all lightened, you know, and it's subtle. It's hard to measure, but I can notice it, like, because, you know, it's on me every day, and I can notice that there has been like lighter body hair, even lighter than spironolactone, you know. So and I like not having to take the spironolactone every day. It was causing like lightheadedness and dizziness, like when I would sit for a while or lay down and then try and get up, I would get really dizzy spell for a few moments. And it was inconvenient. It wasn't like a big deal, but it was very noticeable. And I'm glad I don't have to take spironolactone anymore for that. Probably easier on my liver. I don't know. I haven't really changed my dosage of estrogen. So that's where we're at with medications. Maybe you could just consider it an extreme body modification. It is the nut delete. And I love it. I feel great. So the best thing about spironolactone and now an orchiectomy is that without testosterone, I do not have this like driving, yearning feeling to like meet someone and find someone to have intercourse with. And I really think that that is very much related mentally and emotionally to testosterone. For me, it makes me feel very like yearning and longing feeling, and very, you know, like I want it so bad, you know. And like obviously in the world, that is not that's not a desire that can be met constantly for everyone, you know. And it's not a good thing to base my life on, is fulfilling that urge to have intercourse with someone. And so I am glad that that urge has been lifted and permanently. I feel a real sense of relief knowing that I can go forward with the rest of my life, and that that urge is not going to come back. And I am free of it. I still enjoy play, you know, sex, the idea of that, and the closeness, and the, you know, the connection with a caring partner is amazing. So, and my desire to do that is not really harmed by that, but there's a different kind of energy that comes with testosterone, and I'm glad that it's gone. Another effect of not taking spironolactone on a daily basis is that my skin and my scalp, especially the skin on my face and my scalp, are a bit more oily. I haven't really broke out, but like my skin was, for several years, has been so clear, and my scalp, like I almost don't have to wash my hair except like once a week. Or at least not my scalp. It just does. It's not too dry, but it's not oily at all. And my face was gorgeous in a lot of ways. And so now it's a bit more oily, and just life. I really was glowing on spironolactone and estrogen. Just my skin was like plump and smooth, and it's sort of shrunk. I don't think I'm carrying water straight quite the same. I think I've lost a few pounds, which is strange because I've been eating just fine. I don't know. I don't make all the rules. I'm just trying to observe. Get it, girl? Even if you're keeping your junk, like the dick, I think you should yeet them things. I mean, that's just for me. I can't tell people what they should do, but if you're considering it, I don't know. I think it's really good. It's been good for me so far. I'm really happy about it. I think that when I do get vaginoplasty, I think that it may be easier to heal, because there's some big nerves involved in those, how that function there. Like, that's some heavy duty blood flow and nerve. And I think to have that healed and sort of out of the way, I think that maybe could make recovery from vaginoplasty much easier. I'm hopeful. I don't know how anyone would ever compare it apples for apples. Yeah, like I don't think it's such a terrible thing to have a 2-stage kind of thing, because vaginoplasty is a big and traumatic surgery. So I'm hopeful that it might make it easier. And like I think that they're doing big things, that they're really learning a lot and improving the surgery and the techniques. And so I honestly think that like waiting a year or waiting 2 years, I think that waiting a year or 2 years or 5 years, there might be really great like developments or advancements right around the corner, especially when you have a political sort of climate that is open-minded and supportive of our community, that that allows people to get surgeries and encourages insurance companies to, you know, provide coverage for people who having dysphoria and need this type of thing. I really think that this is a really excellent procedure to pursue. It's easy to recover from. I didn't really do much but go home and wait till I was feeling better. I had to, you know, they gave me some ointment to put on it so it didn't get too dry, but it healed so fast I hardly needed to use it, and I've had no follow-up issues or side effects. So I think it's definitely something that you might consider. It's a I guess it's not even nearly a half step to a vaginoplasty, but it's definitely a consideration if you are trans or non-binary, or you just are very dysphoric about those parts, and you want to live free of an excessive desire to have lots of intercourse. Might be for you. So this has been very graphic, and I think being straightforward is the best way to really answer these questions and not beat around the bush. So I hope that I didn't shock anyone with my answers, but you knew the job was dangerous when you took it. You've come to my channel before. If you haven't, please subscribe, and thanks for watching.